Good afternoon, everyone. This is Sauro Arakinias, your clinical pharmacist. So this is another video about colloids and crystalloids, including albumin. I want to get into more in the differences between crystalloids and colloids, question that comes up often, especially in the hospital pharmacy. So crystalloids, number one, they're aqueous solutions of mineral salts, including sodium chloride or Ringer's lactate and or glucose. Distribution-wise, they're easily distributed throughout the extracellular fluid compartments, including the intravascular and interstitial spaces. It include normal saline, Ringer's lactate, dextrose 5% in water. Advantage of crystalloids includes relatively being inexpensive. So from the cost standpoint, readily available, easy to administer, and effective for initial fluid resuscitations. Disadvantages, it's rapidly distributed out of the bloodstream, requiring larger volumes for effective volume expansion and potentially leading to edema. So how about colloids? Colloids are solutions containing larger molecules, including proteins, starches, and synthetic polymers. Suspended in a crystalloid solution. From the distribution standpoint, it remains primarily into the intravascular space due to their size, exerting oncotic pressure, pulling water into the bloodstream. Some examples would be albumin, dextran, and hydroxyethyl starch or hetastarch. Advantages: it can expand blood volume more effectively than crystalloids like lactate and Ringer, and which they have the smaller volumes, potentially reducing the overall fluid administration. Disadvantages of the colloids include they're way more expensive than the crystalloids, potential for allergic reactions or coagulation disorders, and may not be as effective as significant as if there were the significant capillary leakage. In summary, crystalloids are generally the first choice for the fluid resuscitation due to their availability and low cost, while colloids may be considered in specific situations where rapid volume expansion is critical, including those in hypovolemia patients, or where a large volume of crystalloids are not tolerated. So again, this is another video comparing crystalloids, including normal saline, Ringer lactate solution, and dextrose 5% in water, to colloids such as albumin, hetastarch, or dextran, and their advantages and disadvantages. Again, crystalloids cheaper, good for rapid fluid resuscitation, and colloids more expensive, but they're good for rapid volume expansion and keeping the fluids in the capillary space. For more questions, make sure to comment on the video with your questions, and I'll be happy to answer any more questions you may have on colloids versus crystalloids. Hope you enjoyed this video. As always, stay safe and take your medications.